Hello everyone, I'm Dr. Swapna Bhaskar, a family physician from Bangalore. Today I'm here to talk to you about the hottest topic of the season, something which everybody wants to know about and have a lot of doubt about, and it's none other than the COVID vaccination. All of us know India is on the verge of the second wave of infection, and experts have told that we cannot bank on natural infection to give us herd immunity. So, vaccination is the need of the hour. The vaccine was launched in January, where the phase 1 covered the healthcare workers and those people who were maximum prone to it. Currently, phase 2 is going on, where people above 60 years and those above 45 years with certain diseases are being given the vaccine. Now, who are the people who can get the vaccine currently now? Those above 45 years with diabetes for more than 10 years or any complications related to it, those with high BP or hypertension, those with any form of heart disease, those with kidney disease and dialysis, liver disease like cirrhosis, lung diseases like asthma, chronic bronchitis, COPD, those who have had stroke, those who have cancers, solid organ cancer or blood cancer or lymphomas, those who are on anti-cancer drugs, those who are on drugs which causes low immunity or immunosuppressant drugs, those who need organ transplantation or those who are in the waiting list for transplantation, and also people who need high support, like those who have mental, physical or intellectual instabilities which make them need for high support in the society. So all these people can go ahead and get the vaccine in the phase 2, and phase 3 will soon be launched, where the general population will also be offered the vaccine. So currently there are two vaccines, Covishield and Covaxin. Covishield is a little different virus taken from the chimpanzee, and a small quantity of that virus is given into the human body, and Covaxin is the inactivated SARS-CoV-2 virus. Now, both of them act in a similar way, in that when you get the vaccine, the body perceives it as a virus and starts producing antibodies against the virus and stores it in the memory. Now, when you get an actual viral infection, these memory cells will wake up and start producing antibodies against the actual infection. As far as the efficacy is concerned, both vaccines somewhat score similarly. Covishield has about 70% and above, whereas Covaxin has slightly high, 81% and more. And Covaxin produces the immunity which is more similar to the natural immunity produced by the virus. As of now, these vaccines cannot be interchanged. So the second dose has to be the same vaccine that you have taken as the first dose. And currently there is no option for you to choose the vaccine, as the vaccine which is available has to be taken. Hopefully the option of choosing might come. Covishield is what is being given commonly, whereas Covaxin is given in certain centers after our Honorable Prime Minister took the first dose in February. Now, where can you get the vaccine? The vaccines are available in all government hospitals and clinics, healthcare centers, and also certain specified or approved private medical hospitals and medical centers. How can you get the vaccine? Elders can just go with their Aadhaar card, whereas those above 45 need to download a form from the government MOH website, fill up their morbidities or fill up their other diseases, get signed from your treating physician, and then go to the vaccination center with your Aadhaar card. So now we know who can take the vaccine and what are the vaccines. Now the dosage of the vaccines, both vaccines need 2 doses. Covaxin is given at an interval of 4 weeks and Covishield is given at an interval of 6 to 12 weeks. When does the immunity start developing? The immunity starts developing after the first dose also, but good immunogenicity or good conversion to immunity happens only after the second dose is given and after a time gap of 2 to 4 weeks after the second dose. How long does the immunity last? Current studies say that the immunity lasts for about 8 to 10 months, but still the studies are still ongoing, and to date this is the immunity lasting time of immunity. We don't know, post some months later we might see that the immunity might last longer, or is there a need for a booster, is there a need for a vaccine after 1 year, and so on. So now what are the common side effects that you see? Both vaccines cause simple side effects like fever, body pain, headache, little giddiness, viral like symptoms like mild cold, sometimes itching or pain or rashes around the site of injection, a little hardness around the site or redness around the site of injection, sometimes nausea, little giddiness. So these are common side effects seen with both the vaccines, which usually need not be treated. People who have severe myalgia or high fever can take a small dose of paracetamol or ibuprofen as and when needed. Severe side effects like anaphylaxis or sudden death following the vaccines, certain neurological side effects, and sometimes blood clots are very, very, very rarely known to occur. And more studies are there on Covishield than on Covaxin regarding these severe side effects. So any severe side effect to the previous vaccine or the previous dose of the vaccine is a contraindication to take the next dose of vaccine. The other major contraindications where people cannot take vaccine is pregnancy, people who are planning pregnancy in the next 3 to 6 months, breastfeeding mothers, and currently children below 18 years of age. There are a lot of studies going on in pediatric age group, and hopefully the vaccine will be available for pediatric age group in the coming months. So there are some common myths associated with the vaccine. I will try and address few of them. The most common ones are, can I take the vaccine if I am on blood thinners? Yes, simple blood thinners like ecospirine or clopidogrel is not a contraindication. But if you are on higher doses, your doctor might ask you to take it, keep aside the doses for a day or two. If you are on anticoagulants like acetylcholine and warfarin, then you should meet your doctor and get your INR tested, and only if the INR is below 3 that the vaccine should be given. For those above 3, you should wait for the INR to come down. If you are on certain drugs for rheumatoid arthritis or anti-cancer drugs where the total WBC count or the white cell counts are below 1000 or your platelets are below 20,000, you should be waiting again till the counts improve. If you have any infections like high fever, urinary infections, lung infections, throat infections, etc., you should again hold on to the vaccine till you are completely recovering out of any acute infection. What if you have had COVID in the past or currently you are having COVID infection? Anybody who is having an ongoing infection of COVID should not take the vaccine again till complete recovery, and the usual time we say is about 4 to 6 weeks. Those who have recovered out of COVID in the past can still take the vaccine, because even if you have natural immunity related to the infection, the vaccine enhances the immunity and gives you more protection from a repeated infection. Those people who are having simple allergies like drug allergies or sulfur allergy or antibiotic allergy or food allergy like nuts and egg allergy, fish allergy and all can safely go and take the vaccine. There is no contraindication. But make sure you just mention your allergies to your vaccinator or the site so that they are aware of your previous history of vaccinations. Any previous history of severe systemic allergic reaction or severe allergic reaction to any vaccine or any drugs or any injections is a relative contraindication to take the COVID vaccine, and this should be informed to your vaccinator or your vaccine sites. Another common question is about alcohol. Can we take alcohol after the vaccination? Definitely there is no contraindication or no major problems after taking alcohol. But it is advisable not to go for binge drinking, because binge drinking can bring down your immunity and the vaccine efficacy can come down. Similarly, people who are taking drugs which bring down their immunity like steroids or rituximab and drugs like that, also we should understand that the seroconversion can be a little less and your vaccine may not be as efficacious as it is for normal people. So I hope I was able to address the major concerns that were related to the COVID vaccine. Please do let us know your feedback on the video and give your comments. If there are any queries, you can put it there. We will try and answer. Please do like our YouTube channel and subscribe to it, and we hope we will be able to give you more such videos related to your health. Thank you and take care.